I'd like to welcome everybody to today's medical marijuana awareness webinar. Today's subject matter is pain management and medical marijuana. This is a subject that I know for a lot of people is important. Pain management is the #1 reason that people use medical marijuana. It's something that I know it's near and dear to a lot of people's heart. I know it is mine. I use it for medical marijuana, and we'll chat a little bit about that as we go along. But this is an important webinar, and it's something that we take seriously. Medical cannabis can help with a lot of things, and there's been a lot of success in this particular area. And so we'd like to talk to you about it. And our objective today is to really have you get information about pain management, medical marijuana, and how it works. Helping me today is a gentleman named Alex Ford. I've had a chance to work with Alex in the past. He's had a lot of experience in the cannabis space. He's one of Trulieve's, let's just say, stars in the field. And so, Alex, tell us a little bit about yourself and what you do and how you do it.
Yeah, thanks, Mark. So, as Mark said, my name is Alex. I'm a community educator with Trulieve, which means I work with our physician partners throughout the Central Florida area. I cover Lakeland all the way to Pinellas and as far north as Citrus County. So I've got quite a large territory, got a ton of physicians. And that's what I'm doing every day is just out in the community, helping the physicians and doing events with new patients as well. So it's definitely a fun job, keeps me active, and love the chance to get in front of patients whenever I can. So thanks for the chance, Mark.
Yeah, I think one of our objectives of these webinars is if we can make just one person's life a little bit better, if we can help one person get their life back, I think we've accomplished something. And of course, obviously, we'd like to do more than that. But before we jump into Trulieve and everything, one thing came out to me when I was preparing for this. You all have, we're going to talk about it at the end, but I think it's important to bring it up now. You have some consulting services. You have some consultation services people can take advantage of. Is that right?
Yeah, that's actually correct. We launched over the summer what's known as our virtual consultation program. It's a great service. It's open to patients and non-patients alike. So even if you're on the fence, not sure if you're ready to get your card yet, you can still book one of our virtual consultations. You can book it at a specific location, and we have a team of seasoned, experienced individuals at each store that handle these virtual consultations. So basically what you get is you get a 30 minutes time slot with another consultant to have a one-on-one conversation. So even if you can't get the video chat software to work, we can still just give you a call and have a one-on-one phone call, and you can schedule as many of those as you like. So, like I said, non-patients and patients alike, feel free to schedule those whenever you like.
Yeah, I think that's important. I wanted to bring it up front because a lot of people have questions. A lot of people wonder where they can go for answers. You have a vehicle to do that. I'm going to recommend you to do that. So we'll get more into it. I think it's important when we talk about the subject, first of all, whenever you're talking about your health, always get your doctor involved. If they're not into medical cannabis, candidly, get another doctor to be, most doctors are aware and are favorable towards it, but so there are people that aren't. But we don't want you to go out doing things that are going against anything that a program that you might have set up that's helping you today. Again, our goal is to not only help one person get their life back, but also to provide informed information about cannabis. There's so much information out there, but a lot of it's just not true. A lot of it is tainted by, no offense, pharma and alcohol. So what we're trying to do is give you the straight scoop as to what's out there based on science and a lot of discussion, a lot of things that are out there. This is a sensitive subject. I think it's important to be mindful that this is important to a lot of people. So please feel free to ask questions. You'll see down below, you'll see down here, you see a little double round thing. It's for asking questions, and please feel free to ask questions. Our goal today is also to answer your questions and be here to be a resource for you. So please feel free to do that. Let me jump into this and talk about pain. Chronic pain is the most common reason that people turn to medical cannabis. Now, we got that information from a group called Kenigma. You might ask, who is Kenigma? Kenigma is one of the top research groups in Israel. And we'll talk more about Israel as we go along, but this is a key group that's been doing a lot of studies in medical cannabis, not only here in the United States, but around the world. And they're finding that chronic pain especially has been something that not only does medical marijuana help, but it's something that a lot of people are looking at. Chronic pain is often misdiagnosed. That's the biggest problem with it. And the reason for that is that if you take a look at what pain is sensory. It's something that you actually can sense. And it's a combination, in that sense, comes from not only the sensations, your senses in your body, but also from some emotion, some physical factors. Fear will cause pain. Future expectations do that. Um, it has to do with somic and autonomic nervous system, that freeze or flight response that you get. All this basically boils down to something that is a muscle activity, heart rate, blood pressure, causes some sweating. But pain is something that is it's your whole body experiences in a number of different ways. And what's interesting is chronic pain is something that persists for 3 months or more and recurs regularly. It's something that usually comes along. And what's interesting is it's usually caused by two or more conditions. And that's why it was hard to diagnose. When I got involved in this field 7 years ago, doctors were telling me there's no such thing as chronic pain. I had chronic pain, and I said, "Listen, if I respect what you're saying, but let me talk to my body. It doesn't agree with you." What's interesting is that the doctors are trying to diagnose two different, sometimes three different symptoms. Inflammation causes it. You might have something that's due to an injury. It might be something that has to do with tweaking an elbow or tweaking a knee or something like that. So there's a number of different reasons that it's there, but it doesn't go away. That's the one thing that's really interesting. So when they have two or three different conditions, medical field likes to treat one condition, one pill, one condition, one pill. And so until they understand all the conditions, it's hard for them to really complete their diagnosis. That's what made chronic pain so hard to diagnose. They almost couldn't. Acute pain is something that's completely different. Acute pain is due to an injury or an illness. I had a knee replacement done almost 2 years ago, and basically that's acute pain. That's a particular, I'll call it an injury, where it was caused by a particular situation, and it's painful. I can tell you they're no picnic, that's for sure. But I was able to use medical cannabis to be able to keep my pain level pro-surgically, literally 2 days after the surgery, down to a pain level of 1 or less, to all the way to today. And I'll talk a little bit more about how that happens. But there's acute pain and there's chronic pain. And again, chronic pain was so hard to diagnose. We'll show you why as we go along, why medical cannabis is so good for chronic pain. But again, it's one of the not only the top reasons that people turn to medical cannabis, but if you talk to a lot of a lot of folks, you'll find out it's one of the top reasons for long-term disability that's out there. So what's interesting is in 2019, when there was a study done, again, our friends in Israel, what they found was a couple of things when they compared cannabis to alternatives for pain. So if you have pain, there's different alternatives. What they found out that is if they have opioid-based medications, which is really designed for short-term pain management, not long-term pain management, it found that cannabis had no record of fatal overdoses, something that you worry about with overdoses. It also found out that cannabis didn't hurt your kidneys, didn't hurt your GI tract, didn't hurt most of your body. And in fact, it didn't really damage your liver, which things like Tylenol, Excedrin, and those types of things did. So what they found out was the pain medications, again, coming from pharma, especially over long-term use defined to be 3 months or more, tended to have negative effects on your body. That was something that didn't happen with cannabis. And in fact, what happened with cannabis was it was just as effective in managing your pain without all the negative side effects. And these are all research studies that have been done. I'm quoting one here, but there are others we'll show you during the presentation that's out there. What does it specifically address? You've probably seen this, Alex. You've seen it with chronic pain, ALS, Parkinson's, epilepsy. There's a number of different conditions that they know, and they've done studies that are out there. And interestingly enough, a lot of those conditions, almost all of those conditions, are conditions that help you qualify under the state of Florida to be able to get your medical marijuana card. So it's proven safe, offers options, and really helps you, especially with pain management, without using opioids. It's really a positive thing that a lot of people have discovered and a lot of people have figured out. So I'm just trying to show you that this is something that's been proven. It's something that's been studied. It's something where there's been clinical trials. Now, I should also point out that here in the United States, cannabis is a Schedule I drug, which means there can be no research on it. It's considered to be not have any medicinal value at all. So where did all these studies come from? All these studies come from overseas. And so you'll find that almost all the studies that are out there, which are pretty close to, in the case of pain management, pretty close to over 5,000 clinical studies done over the last 20 years, you'll find it all are coming from either Israel, England, Germany, Spain, especially the number of different places that are out there. Um, let me give you some things that's happened here in the United States. Which you take a look at, the University of Davis did a study, and they took a look at low doses of inhaling cannabis. Now you might say, how did they get a study to do that? State of California gave them a grant to do that because they've had cannabis for a number of years. And so the first thing the University of Davis did was go out and try to study low doses of inhaling cannabis. What they found is it helped with neurologic pain and also with standard pain treatments. McGill University, by the way, McGill is in Canada. It's in Montreal, as they say. Also reported significant relief from pain, sleep, being able to help you with your sleep, your anxiety. And participants also found that the other conventional pain medications, meaning the pharma drugs, actually failed. It's interesting how compelling these studies are, especially as they're being done. Now, Canada is not a Schedule I drug. Canada is both, cannabis is legal, and they do a lot of studies on medical cannabis. One thing I might point out is why is cannabis legal in Canada? Canada has socialized medicine. There's a one-payer system. Government pays your bills. They did studies with Israel, and they did it over 4 years. This was done about 8 years ago, starting 8 years ago. What they found out after 2 years of studying, actually almost 3 years of studying, was the amount of deaths dropped 18% using cannabis, which was amazing. Again, if you're in a system where it's there, the cost went down almost 30%, which was really interesting. There was nothing but positive benefits that came out of it, which is why they legalized cannabis and why they're doing so much research up there. And you'll find that that's why so many companies out of Canada, out of Toronto, and out of Quebec are in the cannabis industry, and they own a lot of the companies and resources here in the United States. So there is compelling evidence that's being done here in North America. These are the studies that are there, and I'm not going to go into each and every one of them. You'll see some great names that are out there, Sanchez and a few others. These are people that have done studies over the years. I've just given a few examples, but it's a rich and deep area that people have looked at. I want you to feel comfortable that this is not something. There's not a couple of hippies sitting in the corner that says they think this works. This is something that people actually know that works. Now, I'm going to play a video from Sanjay Gupta. People may or may not have seen it, but I think this explains a lot about why it works, and we'll go into it a little more in depth, but I think it's something that's important to take a look at.
THC, which is the psychedelic component of cannabis, which makes you feel high. And then there is CBD, cannabidiol, the non-psychoactive chemical. We've told you about this one for years, especially how it stops chronic epileptic seizures in young children. There is also research showing that CBD is particularly helpful when it comes to pain. In fact, CBD can do something opioids cannot.
With opiates, you're talking about killing the pain, masking the pain, you're done.
Dr. Julie Holland edited the Pot Book, a complete guide to cannabis.
With medical cannabis, you're actually not just talking about decreasing pain, but you're decreasing inflammation.
That's because opioids do a good job of interfering with pain signals going to the brain. But cannabis works on two receptors, one that blocks that pain and one that decreases inflammation. It's ironic that cannabis can do more than opioids, yet prescription opioids are legal and cannabis is not. Historically, that was not the case. For centuries, both cannabis and poppy, two plants, the natural forms of marijuana and opioids, were commonly prescribed by doctors and dispensed at pharmacies. But that all changed in the 1930s. Opioids would go on to become a best-selling drug, and cannabis became increasingly fringe, in part because one kind of cannabis, called hemp, was a threat to big business. Hemp is a cheap fiber, good for making paper and canvas. It's more absorbent than cotton and could be used as a potential fuel.
So there were a lot of vested interests that sort of put cannabis down, took it away from the doctors, made it illegal.
That's important to understand. A lot of the reasons why cannabis, where we are today, why cannabis is illegal, is Schedule I drug. Part of the reason is because it's a political decision, not one based on science. And what you're going to find is the history of cannabis is littered with political rather than scientific decisions, where there's been science and research that's shown it's good for you, And in fact, are for a whole number of reasons, people ignored it and went forward. And I'm not trying to get political. I'm just saying that if you're worried about how safe it is, and if you're worried about it being studied, it has been. Now, one of the questions, at least when I got involved in cannabis, and you might have a question, is how does it work? Why does it work? And what's the issue that's there? And it works because everybody has an endocannabinoid system. Alex, endocannabinoid system is kind of important, isn't it?
Yeah, just a little bit. The receptors in your body are sort of like locks, if you will, and things like cannabinoids or opioids, those would be the keys, as represented in this diagram right here. So you kind of need that for the cannabis to work. And as you can see, they're all throughout your body.
Yeah, I think it's important that the endocannabinoid system, every mammal, meaning we have this in our body, it has this. And what it does is it controls your pain, it controls memory, it controls appetite. This is how your body basically controls itself and helps regulate itself, is through the endocannabinoid system. It was actually discovered in the 40s, but it wasn't made popular and wasn't brought to light until a lot of the research was being done, again, in Israel, in the 60s and 70s, and especially the 80s, where they found out that this was actually one of the main reasons that cannabis was so effective. But I think it's important to understand that this controls your body. And again, you take a look at, okay, hold on. If you take a look at the CB1 receptors, it's the light blue ones, they're in your brain and mostly in your nervous system. Take a look at the darker ones, those are typically, they're located in your organs and especially in your immune system. So these receptors are in your body, and cannabis works lock and key with them to provide the medication and to provide the resources needed to be able to regulate your mood, appetite, that type of thing. Specifically, how it works is that our bodies produce endocannabinoids. So when your brain sees that you have inflammation, your body produces endocannabinoids to be able to basically go and try to treat it. Now, if you're an older person like I am, your body doesn't necessarily produce the endocannabinoids that it should. Alex, you don't have that problem, but some of us seniors, we do. So what's interesting is there's plant-based endocannabinoids. This is where marijuana, this is where cannabis comes into place. This is where your buds, your tinctures, come into play. Whether it's THC, CBN, CBD, these are products that you can put into your body. And what this does is it helps your body to be able to produce the endocannabinoids that it needs to be able to, again, manage your appetite, your pain, your pleasure sensations, immune, and that type of thing. Now, I do want to point out, you'll hear about synthetic cannabinoids. They're mainly, for example, like Miranol, which is THC only. And those drugs are only used, and be very careful, only use them under very close direction of a doctor. In cases like Miranol, there's no CBD in there. It has some very difficult side effects. There is medical reasons to use it, but they're very limited. I think what's amazing to me is the pharma companies dearly want to get in the cannabis business, and they're trying to produce synthetics. You can't reproduce an apple, you can't reproduce a banana, you can't reproduce an orange, and you definitely can't reproduce cannabis, no matter what they tell you. They can produce some of it, but there's 480 medical properties associated with cannabis, and most of the synthetics barely are cracking 200 of those medical properties to be able to be competitive. Or I'm sorry, to be able to they're putting in their products. Now, all those go into your endocannabinoid system, again, to regulate your appetite, mood, your pleasure. I want to be very specific exactly how this works. Your brain, your nervous system, and cannabis. You put cannabis into your body, it doesn't go into the CB1 and CB2 receptors. A lot of people perceive that it does. It doesn't. It goes into your fatty acids, and you can think of your fatty acids in your body kind of like batteries that stores these. You have neurons. This is your nervous system that'll target and see that you have a problem. And when there's a problem, what it does, it triggers those fatty acids into long chain fatty acids, and those produce the endocannabinoids that get distributed through your blood system to address that particular part of your body and that particular issue: inflammation, pain, GI tracts, those types of things. All the different medical properties. That's how it happens. Now, this is important for two reasons. Number one is if you take a look at your body producing its own medicine, that's the reason why no one has ever died from cannabis. Because it's your body treating itself holistically. It's not a third party drug or anything coming into your body. No one has ever died from the use of cannabis, both recreational and medical. And this is the reason why. It's because your body's producing its own endocannabinoids, and it's not going to damage itself. It may get high, you may have some side effects, but you're not going to kill yourself. And that's the important part as contrasted to opioids. The second thing is your body knows what's wrong with your body. Your body knows if you're taking cannabis, let's say for inflammation, it knows if you have a pain in your shoulder. And so what it'll do is it'll not only address the inflammation that's say in your knee, but it'll also address the inflammation that's in your shoulder. And when it does both of those, that's called the entourage effect. Your body doesn't need a doctor to tell you where the problems are. It knows. Your experience with this, Alex, what's your thoughts?
Yeah, the entourage effect is really an entire other level of medical cannabis. So, there's plenty of products that, have just one cannabinoid in them, and those, provide a lot of benefits just on their own. But the entourage effect encompasses, the different cannabinoids working with the terpenes in the plant as well, to provide a synergistic effect that increases the effectiveness of all the cannabinoids. And the medicine itself. We're going to go into that more later, but it's really a special thing.
Yeah, I think you run into a lot of patients that say I take it for arthritis and my glaucoma's gone. We see that happens all the time. You probably run into a lot of those, don't you?
Oh yeah.
Yeah. So interestingly enough, when I got involved in the industry about 7 years ago, I heard a lot about sativa and indica. Those are the big discussion points, and we've come a long way since then. So why don't you tell us about not only sativa and indica, but take us through the journey of what's happened the last 7 years to where we are today.
Yeah, absolutely. So, way back in the day, there used to be pure sativa strains and pure indica strains, and these are kind of the two different types of cannabis plants on alternate ends of the spectrum. So on one end, you have your indica strains that are on the right. Okay, those are typically, they have broader leaves, they're shorter, stubbier plants, and you can remember the effects because indicas put you into couch. So they're more like your nighttime strains, more physical in effects, great for sleep. On the other end of the spectrum, we have what's known as the sativa strains. They typically have narrower leaves, they grow taller, and the effects are more uplifting, they're more cerebral, and they're typically more used during the daytime as they don't offer as much lethargy. But these days, pretty much everything that you're going to find is going to be a hybrid of some sort. We still classify them based on indica, sativa, and hybrid based on their effects. However, most of the plants will still be hybrids, but we still differentiate them so you can kind of get an idea of the effects before you necessarily have to try the product itself.
I mean, one of the things that your companies like Trulieve, your company's done over, especially the last 5 or 6 years, is you've taken a look at the different properties of cannabis, broken those cannabinoids down into what they call hybrids, and having those hybrids address different medical conditions or be better for medical conditions and really accent that. And we'll explain to you how they do that through terpenes and things like that. But almost all the product that you're buying today are almost all hybrids, because what they're doing is they're trying to address a particular medical condition. That's safe to say?
Yeah, that's a pretty good rundown of it. And just want to also point out that the classification that we used, it's based on effect, and that's really based on the terpenes. The terpenes, if the cannabinoids would be, say vehicles, then terpenes would be the drivers of those vehicles that give you the specific effects. So we essentially classify a product as sativa, indica, or hybrid based on the terpene blend, which gives specific effects.
Yeah, don't get confused. We're using we're talking a lot about the components of it. We're explaining how it works. You have bud tenders at Trulieve that'll help you figure out what products to use. Because I know that when I first got involved in cannabis, I was in an auto accident 4 years ago, and I ended up with 7 herniated discs in my neck and 2 in my back. The opioids weren't the answer. I couldn't work. I couldn't. It just wasn't going to work. And I turned to medical cannabis, not just because I was in the industry, but it was something that really helped me. But when I went into the dispensary, the first time I went, they looked at my record and they told me, here, use this product. Second time when I went in and I said, how did you know which product for me to use? And because there's hundreds of products. I mean, look at the products behind you. Look at all these things that are here. And they basically said, we looked at your doctor has made a recommendation. We know your medical condition, and we're able to say, here's the products that we have that actually will help you with that particular condition. And a lot of that, as Alex mentioned, is based on the terpenes.
Absolutely. And also, guys, this is a lot of information. It's like drinking water from a fire hydrant. That's exactly why we did uh, start that virtual consultation program. And I did see some questions in the chat. Just want to reiterate that is a free service, and you can go to our website and schedule that and find more info on that as well.
We'll have a slide on how to register for that towards the end of the deck, and so we'll answer that particular question. So CJ, we have a slide to answer your question that's out there. But I think it's important also that your body, every person's body is different. I draw a parallel to people that drink. There's some people that can hold your liquor. There's some people that can't. And there's some people one drink and they're done. There's some people that drink the whole bottle and they're just warming up. And your body, that's your body. That's the metabolism of your body. And that's true with cannabis. With cannabis, you really have to figure out what your biology is, and that has to do with your dosing. That's why we would do what we call go low and go slow. We typically chart with a 1-to-1. We typically see how that works. We up the amount of THC and CBD based on how that works, and then also the amount that you take and the frequency that you take it. It takes a week or two to be able to really get your dosing right. Could take longer depending on the medical condition, but I'm saying that it's interesting that you can dial this in to really help you with your medical condition. As I mentioned, I don't know how many people have had 7 herniated discs in their neck and gone through a knee operation, but that's a lot of pain. My pain level is less than a 1, and I've been able to keep it that way because getting into the industry, I figured out what worked and didn't work. I took the time to figure it out. Once you get it right, it really is something that's a big deal. Now, we talk about cannabinoids themselves. Alex, tell us about these cannabinoids that are out there, because you've done a lot of engineering. Trulieve has done a lot of engineering to really bring these to the forefront.
Yeah, absolutely, guys. So this is a little breakdown of some common cannabinoids. Now, the entourage effect that Marc was mentioning earlier is kind of relating to a product or a medicine that has, all of these cannabinoids and terpenes maintained in the actual medicine. So as you can see, the two most popular, most well-known are going to be CBD and THC. Those are the largest ones there, the most common. But the other ones, such as CBG, CBC, THCV, these all have medicinal benefits on their own, and they all increase the effectiveness of each other when they're combined in one product, one medicine. So, for instance, CBN is a cannabinoid that gets converted from THC over time. So when you age cannabis, you increase the amounts of CBN, and CBN is wonderful for sleep, especially in combination with THC. And THCV is one of those unique cannabinoids as well. Most cannabis is, pretty well known to give people the munchies, increase your appetite, at least in the short term. Whereas THCV is one of those cannabinoids that is actually an appetite suppressant. So if you find a product that is high in THCV, it's going to be more likely that it's not going to make you as hungry as others. So, individually, they have a lot of benefits, and together, they have even more.
Yeah, we've been, companies like Trulieve and the industry has learned a lot about these. By the way, don't worry about all the names and things that are there. As a follow-up to this webinar, we will send you an email that has a link to what they call a follow-up page. And on that follow-up page will be links to slides, the slide deck, so you'll be able to go through that. It'll have articles, it'll have information, it'll have videos, again, a video of this particular presentation. So if you want to watch it again or parts of it, you can do that. So we'll follow up. We'll provide you a lot of information. You don't have to make a lot of copious notes. You'll be able to get it. It'll be written down, and we'll provide you all the resource information that we use to help build this particular deck. But it is important to point out that there's a lot of research that's been done. And as we're learning more about it, this helps you dial in. I mean, literally be able to dial in. So if you have pain, nausea, mood, trying to have trouble sleeping, this will help you really dial in and figure out what's there.
Right. Right. And the one takeaway that I do want to highlight is, new patients can really look at CBD as sort of like a, anti-inflammatory alternative. So to replace, aspirin, ibuprofen, and THC is more your stronger pain relievers, such as like an opioid alternative, which can also bring those euphoric effects. And just always keep in mind that CBD is anti-euphoric, anti-psychoactive. So it's your saving grace If you're maybe brand new to cannabis, you've never experienced THC, you have a little bit of reservations there. If you keep some CBD on hand, that's always going to be your backup plan to. If you do over medicate, you can reduce the amount of time that you're uncomfortable and reduce the severity of that euphoria as well. So that's why Mark mentioned, start low, go slow. It's common to start with like a 1-to-1 ratio because the CBD that's present does reduce the euphoric potential of the THC in the product. So just really want to make sure that that gets brought home for you guys.
Yeah, that's really important. Terpenes, you mentioned earlier, the endocannabinoid system is the highway. The driver is what they call demandinides. You have the THC, CBD, which is really the passenger, but really the terpenes really guide and really focus in on your particular medical condition and help you be able to address it. Why don't you talk about terpenes and their effects and the different ones?
Yeah, my pleasure, guys. So, like I said, terpenes is really going to be how we differentiate and categorize the strains because it's based on the terpenes, which is based on the effects. So, for instance, how I was mentioning earlier that the sativa strains are going to be more uplifting, more suited for daytime use. And the terpenes that are going to be commonly present are going to be ones like limonene. So you'll see on the top right, you'll see a picture of some lemons, which obviously limonene is found in lemons and citrus, okay? And by itself, it acts as an antidepressant, antibacterial, antimicrobial, anti-carcinogenic, an immunostimulant, right? So that terpene by itself has a ton of medical benefits, but that's just one component that makes up the scent and flavor of, say, one strain.
Alex, it's interesting. A lot of people look at this and say, this is very similar to aromatherapy. These are the same things you find in aromatherapy that, for example, if you use lavender or linalool, it helps people relax. The answer is it's basically the same thing.
It really is. And just like if you were to find, like a invigorating morning body wash that's supposed to wake you up, it's likely going to have these same terpenes, like in a sativa strain that is uplifting. It's going to have limonene and pinene. Whereas if you have like a relaxing, candle or body wash, it's likely going to have some linalool in it, which is found in lavender, okay, which is also found in indica strains, which make you relaxed and tired. So there's a lot of parallels here found in aromatherapy and things like that that really guide these effects. So that's why a lot of times the strain profile, if you see a sativa strain, expect it to have some citrus notes, some pine notes. If you see an indica strain, expect it to have some flowery notes or fruitiness to it. And that can really give you an idea before you even try a product as to the effects that you can expect from that. But again, remember, everyone's different. So some people can use indicas all day long, and not get tired. And some people are very, very sensitive, just a little bit of an indica and it makes them want to go to sleep. So it's just something that you got to feel out. And, just keep in mind these pictures do represent, the things that you can find these terpenes in. So one more terpene that I do want to highlight is myrcene. It's on the bottom, second one from the left. That one is going to be found in mangoes. And that one's important because that really drives the indica versus sativa effects. So strains that have 0.05% 0.5% myrcene or higher are going to have indica dominant effects. And if the myrcene is under 0.5%, it's likely going to have sativa effects. Now, this also does tell us that, ingesting more myrcene can affect the experience of, when you medicate. So, if you do some research, there's a lot that shows, eating some mango before you use your cannabis can, really change the effects. So a lot of moving parts. It's a lot to kind of digest, but once you get your feet wet, it'll all start to make sense.
Well, and also you work with your bud tenders, work with your dispensaries, because they'll look at your profile, they'll look at your condition, they'll look what the doctor recommends, they'll talk to you about what's going on, and based on what your situation is, they'll recommend products. They'll know what. In fact, we'll show you how you can find out what terpenes are in the different products. It's actually listed, but we'll show you how that is. But you'll be able to target in on that. And you take a look at things like pinene. Pinene is great. It's an antiseptic, it helps bronchial inhaler, anti-inflammatory, memory aid. It's great for that. However, if you have PTSD or PTS, I should say, PTSS and PTS, not recommended that you use pining, because what you're trying to do is not that you don't want to bring back a whole bunch of memory effects. What you're trying to do is you're not trying to suppress them, you're just trying to keep them at bay. So pining is not necessarily something. Again, some of these are plus and minus things, I think, but you have to, but again, talk to your bud tenders, talk to your doctor, and they'll be able to help you with the particular product. It's not magic. It's something that, again, your dispensary, your bud tenders will help you figure out exactly what you need and what's there. Now, here's there's a couple other in the deck. There's a couple of these that are really important. I put this in here because, again, taking a look at, like, when you look at linalool, which is that aroma flavor, that's the second one from the bottom. This is your mood enhancement. This is lavender, is what it basically is. For stress relief, you have a lot of, believe it or not, the black peppers and cloves with the carotene. That's very, very important. That's there. So there's different ones, as you say. There's different. These are kind of the top 5 that you'll find out there. But there's a couple hundred terpenes when you take a look at the whole spectrum.
Absolutely. And we will show you a bit later on how to, identify the amounts of certain terpenes in your products as well. So don't fret about that too much.
Right. And this is this is a famous thing called a CBD wheel. I'm sorry, you want to walk us through that, Alex?
Absolutely, guys. So this is really informative to kind of highlight, the fact that all those cannabinoids that we saw on the previous slide, how they have, multiple individual medicinal benefits and a lot of potential for various, different conditions. So the very inner wheel, you can see it's sectioned off by, neurological, mood, gastrointestinal, pain, sleep. The wheel just outside of that shows you the cannabinoid or cannabinoids that have shown to have medicinal benefits in those areas. And then the very end wheel are examples of conditions that they're known to help with. So for instance, something like cancer down there, you can see that it's got CBC, CBD, THC, CBDV, CBG, and then you have something, glaucoma, fatigue, asthma. Just THC is great for those. And again, this just really shows that it's one plant that contains many different medicines.
Yeah.
Okay, so like Marc was saying, he can use something that's one thing that helps with both inflammation and pain to treat 2 different symptoms. And this is just a visual of that.
It's interesting to me because this is again, there are 480 medical properties to medical cannabis, and that's remarkable. And what's interesting is when you break it down this way, where they've actually gone in, and this is, we mentioned what's been going over the last 5 or 6 years is beginning to understand this product and how it works. You can actually target, for example, if you have stress or if you have pain or if you have arthritis, you can take a piece of this wheel. Here's the arthritis section right here, that here you have it here, and it talks about what product you should look at over here when you go in. And so again, this wheel will be in your deck, again, in the follow-up information, so you can take a look at it. I kind of look at it kind of like, I grew up in the San Francisco Bay Area, and when I was a kid, we used to go to the Chinese, literally the Chinese doctors, and say, I've got this particular problem. Like I had, I literally had poison oak one time, and the guy looked at me, turned around, went to his little boxes, pulled out a whole bunch of stuff, made me some stuff to make tea, which by the way tastes terrible, smelled even worse, but did get rid of my problem. But I'm saying this is kind of the same thing, where we're able to go out and look at the different components, how put that into the products that are there to be able to address your particular situation. Again, accent your situation by the amount of terpenes and the strains that are out there. That's what strains are all about. This is important, very important to help you figure out how to help yourself moving forward. Let's talk about something that's really important. How do you take it? I know when I got involved in the industry, there was this perception that everybody be sitting on the front porch smoking a joint, or a fatty, as they call it. That's so passe. That's gone basically. Tell us how you people can take it, and what's the best way to do it.
Yeah, absolutely. So in the state of Florida, there's 5 approved routes of administration, and these are a little bit specific, not as general as just 5. But as you can see, there's different onset times, different duration times as well, and each route has certain products that are contained under those routes that can only be dispensed through that route. So for instance, there's the oral and sublingual route. They're two separate routes, but they're sublingual is sort of a subcategory of oral. So the oral route of administration would include capsules, right? So as you can see, that's the third one down. Those can take effect anywhere from within 30 minutes to 2 hours. So the onset takes a bit. You really have to, take your dose and be patient and see how that's going to pan out. You don't want to run into, where you take a capsule, you don't feel it in 30 to 45 minutes. So you go ahead and take another capsule, and now you might be in for a little bit of a bumpy ride for a little bit. Edibles are going to work very similar to capsules in terms of how they're metabolized. And sublinguals, they're going to be just a little bit different. So what a sublingual product really entails is that you're letting it absorb in the capillaries under your tongue and in your mouth before you swallow it back. So it gets a chance to hit the bloodstream without having to pass through the liver. Okay, so the onset's quite a bit faster. You can see 15 to 40 minutes, and it's still going to last 4 to 6 hours, but not quite as long as, an edible or a capsule. So the other most common route is probably going to be the inhalation route. So that's going to encompass vape pens. Now, the inhalation route is going to be like your breakthrough medicine. So when you inhale something, it goes from your lungs right to your brain. So it takes effect very, very quickly, but it also wears off a little faster. So you can see that the duration is a little bit short in there, only 2 to 4 hours. Now, of course, too, everyone's a little bit different. If you have a high tolerance, or you're very experienced with cannabis, that could shrink down maybe 2 to 3 hours or 1 to 2 hours there. So it can vary. Then we have the topical route.
And I want to point out something, Alex. I'll have you continue.
Sure.
I want to point out something. You can mix and match these. I think I mentioned earlier that when I have, again, I have the ambiance of 7 herniated discs in my neck. And when I wake up in the morning, if I'm not taking cannabis, I will have a pain level of a 7 or an 8. Now I can literally within 3 minutes get that down to a 1, a pain level of 1. How do I do that? Well, I take the sublingual drops that I know work for that. That's going to take 15 for me, it takes about 15 to 20 minutes of work. But I hit a vape pen. I literally take the vape pen, take 1 or 2 hits out of the vape pen, and the pain will go away within a minute to a minute and a half. Now, I do have to tell you, the first time you do that and you take a hit off the vape pen and you have a high level of pain like that, and the pain goes away, you kind of look at, I said to my wife, what is going on? This is crazy. It's kind of like somebody took a rag, wiped my back, and the pain went away. I mean, even this morning when I did it, it's like, are you kidding me? I'm always amazed by that. But you can mix and match these routes of administration. So I can get my pain level down to a 1 or 2. And then what's interesting is with the vape pen, then when the sublingual drops kick in, they take me to the next 4 to 6 hours. Now, in my case, I have a morning, a midday, and an evening regime. And sometimes I'll do a regime just before I sleep. And I know there was a question by Donald, and Donald will answer your question that falls in that category. But this is something that you can mix and match. Especially as you experiment with it and you learn what works and how it helps, you can really dial this in, is what I'm trying to point out. But tell us about topicals, because topicals and edibles are kind of important pieces.
Yeah, absolutely. Well, I was going to wrap up topicals, whereas those can take effect very, very quickly. And they can, in some cases, last a decent amount of time, 1 to 2 hours in most cases. So when we back up, just like Marc said, with the inhalation being a breakthrough and oral sublingual topical kind of being, more of an extended relief type thing, that's how you'd want to use those. So if you're trying to get sleep, you would, take your oral or sublingual, before bed or at bed, and then use a inhalation product to feel sleepy. Now the other products would help you stay asleep all night long. Just like Marc wakes up with pain, so he would wake up, take his oral sublinguals, right, and then use his vape pen to get rid of his pain immediately, and then the orals and sublinguals will kick in before the inhalation wears off, which will get him, through a good portion of his day. And then if it's a bad day, maybe he's doing a lot of yard work, maybe he's golfing, he can use that vape pen, in the meantime until he gets to his next oral or sublingual dose. So you definitely kind of want to try to use both, all the routes together, because then it helps your tolerance stay lower. It helps the medicine stay as effective as possible. And of course, at the end of the day, it's going to save you some money.
Yeah. And I think if people don't like to vape, and that's legitimate, you still have the topicals, so you can rub those on, and again, they work almost immediately. So there's a couple of different routes of administration that you can use in order to be able to really address your day. And then there's also transdermal patches that are out there that you can put on that the microdose that release these things over time, and that help you quite a bit. So there are different. It depends on what you're comfortable with. It depends on what you like. It depends on what you're going. Tell me a little bit about the sprays, flowers, and crumble and shatter.
Yeah. And also an alternative to vapes too. Just want to touch on that since we already covered the sublinguals. Is that we do have what we call true nanotechnology. So it's a nano emulsification where we basically make the cannabis molecules a lot smaller. We'll touch on it more later, but the absorption is increased about threefold. So it's upwards of 90%, and it can absorb so quickly that it can be an alternative for the inhalation route too. So if vaping is not your thing, you just can't do it, we do have some special sublinguals that can take effect almost as quickly. But moving on to the sprays, we do have a nasal spray. It would go through the inhalation route. It's designed as like a seizure rescue spray, and also has been very effective for patients in treating migraines. Now the flower, it's known as smokable flower when you go to your doctor, but I don't feel like that's very fair because you're not required to smoke it. There's a lot of ways to, utilize the medicinal benefits of whole flower without, combusting it. So aside from, smoking it, you can vape it. There's plenty of whole plant vaporizers where you don't combust the flower, so you don't get the harsh carcinogens or hardly any of the negative drawbacks from smoking. You can also make tea with it. You can bake with it, make your own extracts, make your own tinctures. So, if you have experience with it or are willing to, teach yourself, there's a lot to be done with whole flower besides just smoke it. So,
Yeah, I heard a statistic that basically about 40% of whole flour that's bought, if not higher, is really used for cooking.
yeah, yep, doesn't
It's
surprise
not
me.
smoked at all.
Absolutely. It's very, very common. And moving beyond flour, the very last thing you'll see there is crumble and shatter. So those, I'm sure that sounds kind of confusing, but those are just names that describe the consistency of a particular concentrate. So these are whole plant full spectrum concentrates. And what that means is that they will also have the entourage effect, just like flour does. So we do have concentrates that are intended to be vaporized and not combusted or smoked that do have that full spectrum entourage effect with all the cannabinoids and terpenes present in the flower itself.
I think when you've been using cannabis for a while, you kind of know what works for you, what doesn't work for you. A lot of people turn to the shatter and crumbles because you can use the same products at just a little bit cheaper. Best way of putting it.
Right, and use a lot smaller amount because it's so concentrated.
Yeah, that's out there. So that's the reason that they're there. But there's a number of different ways to use it. Again, you have to feel for what's comfortable. I'll throw one last one in. My mother, who is 92, was diagnosed with breast cancer almost 4 years ago, and she's been using RSO oil and cannabis to actually fight it, and pretty much very successfully. She's the edibles queen. She carries those puppies in her purse. Now she doesn't drive anymore, but I mean, mom has found that's the best way to take cannabis, and she's very happy with it. She's probably the expert on edibles right now. She lives in California, but she's been how should I say she's been very good at looking at that. So edibles really are something that are something that should be part of the party. However, as Alex said, give them time to work. There are the famous stories of people who buy a candy bar and they take a little piece of it, which they're supposed to take, and it doesn't work in 5 minutes. So what they do is they eat a little bit more, and then they eat a little bit more. And as it says, 15 to 40 minutes, by the time they're finished consuming the bar, they're on a journey. Let's put it that way. So if it says take a quarter of it, have patience. It'll work. Trust me. Same thing with the pills. Don't go looking down a lot of pills that are out there. Now, one of the things I would like to do is I do want to point out, and I'd like to invite people, especially the senior citizens, there is a survey that's being done by the FAU, and it's funded by the state of Florida. And they want to really find out how, for people that are 60 years and older, taking medical marijuana for pain, they really want to get some input on it. So if you have the situation and you're if you could give us your input, that would be great. Again, you don't have to worry about copying this down. This will be followed up. Follow-up material will be provided to you, but it's something that we really would like to be able to start doing some surveying information here in Florida to find out if people are using it, not using it, if they're thinking about using it, what they use it for, and if they have used it, what's it all about. So I'm going to throw a little plug in for that one. It's there. Alex, tell me about Trulieve. I mean, when we've talked about how it works, we've talked about what it does. Let's talk about the actual products that you can pick up. I mean, let's have the tire meet the road. What can I bring home and use that'll actually help me with my pain management problem? And before I do that, I want to mention Lorena brought up a question for so far pain is it better to use CBD or a combination? What's your thoughts?
Well, that's one of those impossible questions that you really don't know until you kind of get your feet wet and try it out. So, like we mentioned earlier, the mantra that everyone kind of stands by is to start low and go slow. So the best thing to do would be to try out some CBD, titrate up, and see if it does give you relief, for your symptoms. And if not, then that's when you're going to start to want to incorporate some additional THC with that CBD still present, and keep upping that THC until you're able to find a comfortable area of relief that you're looking for. So
well, I think the real key is CBD is extremely effective at reducing inflammation,
yes.
And a lot of pain comes from inflammation. Arthritis, for example. When I had my knee operation, my biggest problem wasn't that, yes, my knee was healing and it was hurt, but it really was the inflammation that was causing a lot of the problems. So going heavy on the CBD has helped me be able to reduce that inflammation, aka reducing the pain. So again, it depends on your condition, but the answer is a combination is there. And the question is what works for you. I know that Chris asked me, I mentioned 1-to-1. She asked me what my ratio is. I actually have two different tracks that I follow. One of them has to do with inflammation. I'm trying to manage the inflammation in my body, and the other is a track to manage the pain. And what I found is that I have what I call a regime for inflammation. And so so in the morning, I'll take an inflammation, I'll take a product that literally is an 11-to-1 for the inflammation, but also I'll supplement that with a product that's 4-to-1, 4 THC to 1 CBD. So they're two different products, okay? And that's really to go after the pain. And that's in the morning. That's because when I wake up and of course I have the vape pen. Middle of the day, I use the 1-to-1. And then at the end of the day, I use the more CBD related products, because not only do they help me sleep, but I find that at the end of the day, that's where I've been walking. That's when I've been working. That's when I've been working out. I got into some exercise programs lately. So my body is talking to me about just, hey, you need to worry about the inflammation. I'm not 25 anymore, so I got to pay attention to that. So that my ratios really depend on the time of the day, what I'm trying to accomplish. But I've just targeted pain and I've targeted inflammation, and I found, at least for me, that's the easiest way to understand it. But again, talk to your doctor and also talk to your dispensary personnel. They'll help you with it quite a bit. And before you jump into Trulieve, one of the things I like about Trulieve, Alex, is if the product doesn't work, you can bring it back, right?
Absolutely. And that's, really the biggest thing that's going to set us apart, not only in Florida, but in my opinion, across the country. I mean, being able to return cannabis products is fairly unheard of. And we have, pretty much a, 100% no questions asked return policy. So if anything doesn't work for whatever reason, if you don't like the taste of it, even if you think you're doing something wrong and can't figure it out, that's no problem. Bring it back and we'll swap it out and give you the chance to find something that does work, that you can find some sort of relief, without having to spend more money and bear a financial burden of having to educate yourself.
Right.
So we don't want to put that on our patients. We don't want anyone to leave the program because they can't find relief. So that's basically, us standing behind our products and, what we're trying to do.
Mm-hmm. I know. I'm going to answer one more question before you jump into this from Donald. He said, I have pain in my legs, and if I wake up in the middle of the night after taking some cannabis prior to bed, I'm fearful of waking up in the middle of the night and possibly losing my balance. What can I do for that possibility?
That's a great question. obviously, you know, not a licensed medical professional. So first and foremost, would have to suggest that you consult a physician. However, you know, based on my experience, I'd say that ideally we're looking to not have to wake up in the middle of the night, right? We're hoping to get a full night's rest with the products that we choose. But you really just, again, you want to start low and go slow. So, you know, start with small enough amounts of THC that you know, you don't have to worry about waking up and feeling strong feelings of euphoria. So as long as you don't, you know, overdo it. And again, if you know, when you're first starting out, like we mentioned earlier, you know, having that CBD present, you know, it is anti-euphoric, it is antipsychotic, so it is going to tone down the euphoric effects of the THC. So if you take it with the THC, it's going to help buffer those euphoric effects on the front end. And if you take it after your THC, right, say you wake up and you feel uncomfortable, then you can take some extra CBD to help, you know, counteract that THC some more. But ideally, in a perfect world, you're going to want to titrate up on the THC slowly enough to where you're not going to find yourself in a position where you are over medicated, where you are dizzy, where you are uncomfortable. And if you do, you're just going to want to have some CBD on hand.
One of the crazy things about cannabis, and when I have a knee operation, we actually had a regime set up of morning, noon, and night, and then I was waking up in the middle of the night. That's why, Don, I can relate to what you're saying. I would wake up 3 or 4 hours, and I was waking up. Not that I was in a lot of pain, but I had enough pain to wake up. My perception was, at least initially, was to go grab some THC, higher THC ratio products to address the pain. And then one day it dawned on me after a couple of days that the pain was coming from inflammation. If I was laying on my knee wrong, I was doing something wrong. And I found that when I went and I grabbed from CBD, which doesn't cause me to have any balance problems and doesn't get me high, that was solving the problem. So what I found was, what I did was, I started, when I woke up in the middle of the night, I actually went after more like a 4-to-1, meaning 4 CBD to 1 THC, or 2-to-1, two CBDs to one THC, something like that. That's a ratio type product. And I found that if I went to the higher CBD products, it really helped me quite a bit. And this is just my own experience. I'm not a doctor. I'm not telling you exactly what to do, but it's something you might want to take a look at and try. I also found out that if I woke up in the middle of the night and I did take some drops, you know, I also hit the vape pen, because my vape pen would get rid of the pain right away, if that's what I was trying to address. And the minute that went away, I went to sleep. So again, your routes of administration as well as the ratios are important. And you don't necessarily need to grab a whole bunch of THC to go after the pain. You pay attention to why it's there. In many cases, in fact, almost all cases, arthritis, knee operations, a lot of joint pain, that type of thing, it all has to do with the inflammation. And if you can address that, that really helps quite a bit. So
Absolutely.
it's almost an oxymoron that you grab the CBD, not the THC. So tell me a little bit about Trulieve.
Yeah, definitely. So for starters, Trulieve was the first, and we're the largest dispensary operating across Florida. We recently opened up our 71st location in Gainesville last week, and this week we're set to open up number 72 in Summerfield. So we opened up, we got to 70 locations by the end of 2020. That was our goal, and we hit it. You know, we're approved for 75, and we're really leading the way in terms of patient access, which is our number one priority. So we typically dispense around half of the total cannabis each week in the state as well, and we're very proud of that. So like I said, patient access is our number one priority. We have a call center with staff with over 100 people just answering the phone, answering questions and chats all day long. So we're quite a large operation. We're very proud of that.
So you stand for a couple of things. I know one thing, you talk about being safe and also cost effective. That's something that's important.
Absolutely. So, you know, like I said, outside of patient access, we obviously want the medicine to be safe and transparent. So we do have third-party lab testing for every product that's on the shelf available to our patients. And we are vertically integrated, which means we control everything from seed to sale. So from growing the plant, extracting it, packaging it, even to delivering it to your door. We don't use any other third-party companies to do anything related with the medicine. And we do have the most cost-effective medicine in Florida as well, starting at just 7 cents a milligram. And like I said, with that return policy, it's really unbeatable. And like I said, completely transparent. Our lab reports are extremely thorough, and we are going to go over those a little bit later, just to show you, how to look up those terpene percentages and cannabinoid breakdowns, and be able to compare them across your different products.
Yeah, but yeah, there's a lot of you guys have some good brand pillars to really rely on to help people. Lab testing, really important.
Absolutely,
And this is
we're
where you do use third parties,
we do for the lab testing, but just nothing relating directly to the medicine
right?
and its production. So we are partnered with ACS Labs, American Clinical Solutions. We were the first MMTC, which is Medical Marijuana Treatment Center, to conduct third-party lab testing. We also do our own in-house testing, but of course, the third party is a lot easier to trust. Each product has a specific batch report. We have QR codes on our packaging. You can scan the QR code and it'll link you to our website and ideally bring up the lab report. Sometimes it doesn't take you all the way there, but you still get the number pasted in your browser where it's easy to find. So if you look at the photo, you'll see around the middle on the right side, you'll see where it says potency summary. And that gives you a breakdown of the percentages of different cannabinoids, as well as terpenes under it and the total terpene content. So that's really where you're going to want to compare, report to report, to see like, oh, okay, I tried this strain and it gave me this effects. And then I tried this strain and got these different effects. Well, you would compare the lab reports, compare the cannabinoids and terpenes to really, see where they're similar and where they're different, so you can identify where those differences and effects could have came from. Was it the additional CBD or CBG in the product, or was it the difference in the terpenes that was contained in this product?
Yeah, and what's interesting is on the side of when you get the package, take your smartphone, go to the QR code, just put it up to your camera, and it'll take you right to this particular report that you'll see here. And that's really important. We know that they're safe. We know that it's been tested. That's one of the reasons why they have a medical marijuana program here in Florida. Is you're not buying stuff off the street where you don't know what's out there. It's consistent. One of the things I need every morning, I need to know I'm taking a product that works. I got to have that consistency. I can't have one day it works, one day it doesn't work. Next day I got to take twice as much. I got to have something I can rely on as a professional. I got to get up, go to work. I got to know exactly what works and what's out there.
Absolutely. And our testing standards are the most stringent in the country. So, it's not like anyone's got, tighter standards than us. We test for 35 pesticides, 39 terpenes, the presence of mold or bacteria, heavy metals, residual solvents. And we also added a vitamin E acetate panel, because not sure if many of you I got exposed to it, but a while ago there was a lot of concern about the dangers of certain vapes and whatnot, and they kind of thought that vitamin E might have been one of the culprits. We've never used vitamin E, but we just put it on our testing panel just to put people at ease. So, and if you ever have trouble finding a batch report, you can always give us a call at the call center or reach out to us via chat, and we will make sure to retrieve it for you.
Yeah. Chris had a couple of quick questions we can answer. And by the way, Chris, you made a question. You said it is in APRN. I would tell him to have a cane or a walker near him. That is something that if you do have a problem, I know that when I had my knee operation, I had both. Okay. I just didn't want to fall down. Best way of putting it. In many cases, I didn't have to use it, but sometimes I had to. That's a good comment, by the way. But she also asked, does Trulieve have senior discounts?
Great question, and definitely always best to be as safe as possible. But regarding the senior discount, we don't have a specific senior discount as of yet. We have waived our delivery fees for anyone 65 and older. and also for any orders over $200. And we do offer usually next day delivery statewide. So that's always a benefit, even for your first order, guys. If you live, maybe you're a little bit out in the country, in a rural area, don't have a Trulieve nearby, we will come to you, whether it's your first visit or your, 30th visit. No issues there. And
You do if you sign up for your email or your text message blasts, you do senior discounts now and then.
we do have senior Sunday discounts, just not a specific daily discount for seniors. So every Sunday we do have special discounts for seniors, just not a daily one. Just because I'm going to go over the discounts that are daily a little bit later. So just didn't want to, have anyone tricked.
So here's your ratio products right here. We talked about the ratios.
Yeah, absolutely.
Explain these.
So as you can see, guys, we have just a few ratio products and in multiple different categories. Okay, so at the top we have True Flour at a 1-to-1 ratio, and that's whole flour. That's almost equal parts CBD and THC. We have True Clear, which is our distillate product. So that's just pure cannabis oil with terpenes reintroduced. So that's going to be the most cost-effective form of the medicine, but it's also very, very concentrated. So definitely not something that we recommend for new patients to try out as far as True Clear goes. But being that it's so cost effective and so concentrated, it does have applications for those that have poor absorption, very high tolerance, or if you'd like to make, infuse that cannabis oil in, maybe make your own tincture, cream, or your own edibles. So those can be used for those applications, and we do have ratios and those concentrates.
By the way, 1-to-1 means one CBD, for example, to one THC.
Correct. Sorry about that. Yeah, 1 part THC, or sorry, 1 part CBD to 1 part THC. So if you see those ratios, differed, like an 8-to-1 ratio, that's going to be 8 parts CBD to 1 part THC.
Yeah,
which
down here.
Right. So moving on to the tinctures down there. Oh, I skipped capsules. So we do have a 1-to-1 capsule as well. That's going to be what's known as a RSO oil extract, and that's just a specific concentrate, Rick Simpson oil. Don't want to go too deep into it. It's just a really full spectrum whole plant extract that's pretty well known. If you're interested, definitely Google it. You'll see tons of stuff, and we do carry RSO oil on its own. We also have tinctures, and at the bottom you'll see the True Nano tinctures. So the nano emulsion technology is what I was talking about earlier, that can be used as a breakthrough medicine or as a vaping alternative. So we do have a high CBD and a high THC nano tincture. Okay, so the 8-to-1 is going to be high CBD. The 1-to-8 is going to be high THC. So the absorption is 3 to 5 times in the nano tinctures what it is in the regular tinctures. So please keep that in mind. Even if you do dial in a dose for a certain tincture product, if you go to a nano technology product, you're going to want to start with a much lower dose because the absorption is so much higher. So just want you guys to keep that in mind. But that 8-to-1 True Nano tincture that's high in CBD would be a great product to keep on hand if you do have fear or apprehension about taking too much THC or accidentally over medicating.
That's the type of product that I would keep in the middle of the night when I had pain. And again, it was my inclination was to grab a high THC product, and I found the high CBD product really did the job. Again, it's everybody's different depending on the condition. Exactly. So I don't want to make any black and white distinctions, but try them. You'll see what works. Trust me, your body will tell you very quickly what works and doesn't work. You don't have to.
Right. And just to point out too, guys, I'm sure a lot of you have, the question like, hey, what sets your CBD apart from, CBD that I can maybe find at the gas station or over the counter? And you'll notice on these ratios, we have the ratio for a reason. Okay. So like that entourage effect, all the science shows that THC and CBD work synergistically. So with, certain amounts, trace amounts of THC present, the CBD is more effective. And with trace amounts of CBD, it can make the THC more effective. So the amounts of THC that are allowed in over-the-counter CBD products is going to be much, much lower than what ours is. And then obviously we have plenty of pre-tailor-made ratios. So to my understanding, the science shows that the euphoria from THC stops at about a 7-to-1 ratio, and our True Nano 8-to-1 tincture is over that, but still has plenty of THC to make that CBD as effective as possible.
Right. So ratio, pay attention to the ratios. Again, that answers that question about middle of the night, what do you do? Nanotechnology, you've been using that word and using that word. Tell us about it.
Yep, let's go into it a little bit more. So just to touch on it again, the nanoemulsion is really accomplished by using ultrasonic sound waves to blast the cannabis molecules to make them as small as possible. So if you imagine, like a chain link fence, it's probably kind of hard to throw a watermelon through a chain link fence, right? But a golf ball, a lot easier. So we just make all of them golf ball size, so they pass through, the blood tissue barriers, the blood-brain barriers a lot more efficiently. And we don't just have the nano emulsion technology in tinctures, we also have it in a powder form, which is known as True Powder. So it's going to come with a scooper. As you see there, it looks very much just like a harmless supplement. And each scoop is going to have 5 milligrams of THC in it. And it's very easy to dose that way. And it's also a lot more versatile. So what I mean by that is, say you're taking 1 5 milligram dose. If you want to take it like a traditional tincture and have it take effect as quickly as possible, you can mix that dose in a amount of liquid that's small enough to hold in your mouth at one time, swish it around for about 60 seconds, and then swallow the rest back. Now, if you're a little bit, say newer to THC or cannabis and you don't want it to take effect so quickly, you can mix that same 5 milligram dose in, say, a large beverage and just drink it down over time and kind of avoid, that, rush of onset of, THC effects. So a lot of versatility with the powder. There's no terpenes present either. So if you're looking to kind of just, maybe start to incorporate some THC into your CBD regimen, that's a great place to start. Easy to dose. You're not going to get the effects of the terpenes, so you'll see how how your body reacts to just THC on its own. And also, it doesn't have a strong scent or flavor, which is also very convenient because sometimes the cannabis flavor isn't for everyone. And we also do have a vanilla cream flavored one and a lemon flavored one as well. So just to add some versatility there to the product.
A lot of people put them in their coffee, and a lot of people put them in smoothies and milkshakes.
Absolutely, yeah, it's great in coffee. Coffee masks it pretty well, and it kind of hides the flavor. And the vanilla one is perfect in coffee, especially with some creamer. You don't even notice that it's there.
Right.
But then moving on, guys, down to the bottom, we've got the True Tincture Drops. Sorry, Mark. Just want to point those out because those are kind of like a lozenge. Okay, we've got multiple flavors right now. We also have CBD and 1-to-1 varieties available. We have standard menthol flavor, which is just like a classic, kind of cough drop. We also have citrus and blackberry. Each one of these lozenges is going to be 10 milligrams of THC, CBD, or 5 of each if it's a ratio. I already went over the flavors, and what's unique about these is that they're made with a isomalto syrup, which is a prebiotic fibrous syrup that turns it into like a hard candy, but it's much less lower in sugar. It's a sugar substitute that still sweetens the product. So it's not going to be something that you're going to want to bite down on and crunch. You're just going to want to let it dissolve, which will also kind of delay the onset of those effects. So you're not going to get all 10 milligrams at once. You're going to get it as it slowly absorbs in your mouth and then as you swallow it back.
Yeah, and this again, you can get it as 1-to-1 ratios, for example. And when some people wonder, well, why do you have a CBD and a THC and a 1-to-1? It's because if you want to use more CBD, you have the capability of doing that. So you can mix a little bit of THC with more CBD, or vice versa, depending on what you're trying to affect.
Exactly.
Kind of try it on your own. Let's put it that way. But you'll know right away what your body works with and what it doesn't work with.
Exactly.
Now let's talk. Somebody you asked earlier, how do you set up a visit?
Exactly, those virtual consultations, right? So if you'll notice here on screen, this is kind of like a visual screenshot that we took from our website. So if you go to our website and then click on dispensary locations, you'll see the screen pop up, and you'll notice that under each location, you'll see where it says schedule virtual consultation. So that's a clickable link. And it is specific to the members of that store. Once you click the link, you'll see on the next slide, it'll take you to a bookings page. Very simple. Certain days will be available, certain times will be available, certain ones won't. We might have scrapped
Put
that
that
one.
one in.
No worries. But it's very simple, guys. You can only schedule these consultations when we have the availability. So it's at a time that's going to work for everyone. And if you can't get the virtual software to work, we can always just do a 30-minute phone call, and as many times as you'd like.
Right. But CJ, that should answer your question on how you set those up. Just go there and just click on it, and you're set. You're set to go. You're set to go.
Exactly. And just a reminder, those are 100% free. No charge for those.
Yeah, I think it's great. You talked about discounts.
Absolutely. So these are our daily discounts. Okay. And you'll see on the flyer to the left, we do have a 15% off new patient discount off your first order. And then on the bottom right, you'll see the ID card renewal discount is a $75 discount off of a minimum order of $150. So we actually give that to you once a year, but that'll be your second new patient discount. And then every year that you have to pay the state $75 to keep your card active, we will give that back to you in free product. Just let us know.
Fundamentally, what you're doing with that discount is the state charges $75 to be able to get your ID card. What you're doing is you're basically reimbursing the patient for that.
Exactly. We
I think
refund
it's a great idea.
patient every year.
Yeah.
That's awesome. So addition to those, we also have daily discounts for SNAP card holders or food stamp beneficiaries. That's 10% off every order, and veterans receive 20% off every order. Some of these are stackable, some aren't. Like Mark mentioned, we do have senior discounts that happen, on certain days, like the senior Sundays, just nothing every day. So that would be something where if you're a senior and you're a veteran, you could combine those two potentially up to a certain amount in certain cases. But these are just the new patient and the daily ones. And the little card to the right is just the new patient card. You might see those if you go to a clinic, you do get certified. Always make sure you grab one of those just so you don't forget. You don't need that to receive the discounts. It's just a helpful reminder so you don't forget to tell us, and maybe we forget to apply it.
Yeah,
and if we do, just let us know.
We got a great discount program that really helps, especially paying for the cards here in Florida.
Absolutely. Second to none.
Now these are the hours that you're open. Before we get into that, some anonymous question asked, does Trulieve have strains that have higher THCV?
So that's going to just vary based on the strain. So there's a lot of factors that can ultimately influence the end expression of a certain cannabinoid or terpene, even within the same strain, right? So even if you grow the same strain, the same genetics, time after time again, slight variations in growing conditions and things like that will, can vary, the expression of certain cannabinoids. So it's going to be one of those things that you're going to want to look for on a kind of like a batch per batch basis. It's not something that can be easily isolated at the moment. So you will need to look for full spectrum, full plant products such as flour, certain concentrates.
The RSO, for example.
RSO is definitely one of them. Shatter, crumbles, all those things would be something to look for higher amounts of THCV.
Right, which is great. Hold on, I'm going the other way. I think we lost our favorite slide. You were asking about pain. Someone asked me a question of what products do I use in the morning. We forgot to put our pain slide in there.
Oh,
you have a TruPod product.
Yes,
talking about pain management. This particular product that I use, you may ask me, what do I use? I use this. This is better than Percocet. This product it's a vape pen. It's called a TruPod. It's it's called 1-to-1-to-1, which is Delta 8, Delta 9, and CBD. And literally within 2 minutes, it gets rid of the pain. I mean, this, like I said, this is better than Percocet. And I have found it's my go-to. I mean, I have a piece of tape on it because it's my number 2 pen in case I lose my number 1 pen. It's for being able to make sure they stay charged is the best way of putting it.
Right. And actually, to back up a bit and touch on the THCV question, I do want to highlight that we did semi recently come out with a new pod type vape product that Mark is referring to that would actually be a full spectrum product that could possibly have high amounts of THCV. And that's going to be known as our true spectrum pods. It's just going to be typically you find distillate concentrates in vape pens, but our full spectrum is going to be, or sorry, our true spectrum is a full spectrum vape concentrate in a pod. So it's going to have entourage effects, include those residual cannabinoids like THCV. So that would be a good one to look for. That's a vape and not necessarily like a whole flower or a really strong type of concentrate.
Yeah. Lloyd, you asked a question, what products do I use? I obviously use the TruePod product. I'm an edible guy. Okay. But I do have to tell you one thing they have with edibles. The state of Florida is a great place. What they do is no matter whether you buy orange or if you buy raspberry, okay, all of them look the same. They didn't want kids to be able to use these things like gummies. So when I bought them, I remember I think I called Andrew and said, "Hey, well, how come all the products look alike?" It's because they do taste different. But I use a lot. I use the edibles. I think those are great ways. I use the True Pods. I'm big on the 1-to-1, and I'm big on the ratio products. Those are the products that I primarily use.
Right, and to go in a little bit further into what Mark's really talking about, we did lose the slide on it, but we have a lot of products that are based on what's known as Delta 8 THC. So typical THC that everyone refers to is actually Delta 9 THC. So Delta 8 THC is just an isomer, fancy, term for it. It's slightly different, and it's a lot less euphoric, and it mimics a lot of properties of CBD as well. So it's a powerful analgesic. It's great for headaches, cramps, nausea, but much less euphoric. Okay, and what Mark's referring to is we have that at a ratio with CBD as well as with CBD and Delta 9 THC. So he said he has a 1-to-1-to-1. So that has 1 part Delta 8 THC, 1 part Delta 9 THC, 1 part CBD. And we also make that in a 1-to-1 with just CBD. So you have the toned down Delta 8 THC, and then you still have the anti-euphoric properties of the CBD combined in one. And we have that in, vape cartridges as well as oral and sublingual products as well.
Yeah. And again, it really depends on what works for you. Okay. Like I say, and I do have a middle of the night, in case I wake up in the middle of the night with pain or whatever. Sometimes I'll sleep wrong. I'll do things. I've started a little bit of an exercise routine, and my body does wake me up sometimes in the middle of the night and let me know that I'm not 25 again. So again, that's where the vape pen comes into play with a little bit of a 1-to-1. So depends on every body is different. Let's put it that way. You have a lot of resources on your website.
We do. So, we've gone over the lab reports. We obviously have a section just to retrieve lab reports, a shot page. Our blog is going to be a huge wealth of information. We've got all kinds of topics on there. And our fact page actually has a lot of general info on a ton of stuff too, such as, just how to get, certified, what terpenes have what effects, what cannabinoids have what effects, certain recipes on, maybe infusing our products with certain dishes. So there's a lot to be learned from our fact page and our blogs. We've got videos on there. We also have a link to the Office of Medical Marijuana Use resource page. And then we also have a link to find research. So if you're a science buff and, you want to find some peer-reviewed, studies, we've got links for that too. So pretty much anything you could want to look for cannabis related, you can find it on our website.
Great. So I think, Trulieve has done a great job. I mean, there's a reason why you're number one. There's a reason why you're opening the stores. I think, you're really addressing the medical issues that are out there. Like everybody else, you've grown a lot. I know over the last couple of years, we've all, as Kirk used to say, we're going where no man's ever gone before with medical cannabis. But it's something that it does work. And I do want to point out, medical cannabis does work. If you have pain, we talked about solutions today. We talked about products. My favorite, I'll bring it up again. This is my lifesaver. Seriously, you'll probably find me. It's one of the few products I carry into the shower. That's how much I really trust it. But no, seriously, there are things that out there that help quite a bit. I think I also want to, in closing, what I do want to do is I want to point out, it's not a matter of just cannabis. You really have to have a balanced living. It's how you eat. It's making sure you get enough sleep. It's really using to you restore and control your body. If you're going to get into this, remember it's your body. Put yourself into a balanced living situation. Getting sleep helps quite a bit. And really, it's not a matter of just taking cannabis helps you sleep. A lot of people say I feel so much better. They're sleeping for the first time. You know, my mechanic had a situation where he hadn't had more than 4 hours sleep in 20 years. And I got him into medical cannabis. And the first time he slept 8 hours, he couldn't believe it. And it's actually changed his life. Sleeping made a big difference, but he could not sleep without medical cannabis because of the pain and the inflammation issues that are out there. And that goes back to he got his life back, kind of a thing. So
Yeah,
it's really
and they give you something so small as sleep. Some people joke, the only side effects of cannabis are hungry, happy, and sleepy. And sometimes just getting better sleep can, make all the difference in the world. And I love how, you're highlighting this as a balanced living, especially since cannabis and the endocannabinoid system, it helps regulate homeostasis.
Right.
So cannabis really is about, helping your body and mind find that balance.
Great. So I'm going to show a shameless plug. You and I are doing a webinar again next week on anxiety and stress.
Nice.
Yeah. So we have it next Wednesday. We have anxiety and stress. And I should point out, cannabis is great for that as well. And that goes back to the balanced living issues that are out there. This webinar next week will be on Wednesday. All our webinars are on Wednesday, except for this one. The reason we made this one on Tuesday is because there's a small event tomorrow called an inauguration. And I think a lot of people will be tied up in that for some odd reason. So we just I didn't want to compete with the powers to be. But really, I do think that it's important that we again, we're talking about the balanced living that's out there. There's a lot of research that was used to put this presentation together. And again, this will be available to you just to make sure you understand this is not a couple of hippies sitting on the side trying to put some things together, but it's something that really is something that you can use and it's out there.
Absolutely.
I want to thank everybody for coming to the webinar tonight. We know it's important, and I know it's important to you. Alex, you have some closing remarks and comments you want to make?
Might as well. I did forget to mention when we were talking about, all the sleep, that we do have a fantastic product that is amazing for sleep. I've found it to be just pretty mind blowing. I haven't woken up feeling as rested and refreshed since I was a child. So just one more little plug here. I've got them on hand. So it's our CBN capsules. So CBN is one of those cannabinoids we talked about. It's the one that gets converted via age,
Right.
and combined with, small amounts of THC, maybe like one piece of an edible. The benefits for sleep, you just have to try it for yourself. So if that is something that's, you are trying to find relief from, definitely check out those CBN capsules on one of your first visits. You will not be disappointed.
Right.
And it's also has less euphoric potential than THC. So it can also be a THC alternative for during the day. You just don't want to take it with THC because it will make you sleepy. And additionally, I did forget to mention that we did launch some edibles in the nanotechnology category. We do have some nano gummies. So if you do try the tincture and you love the effects and the onset time, we do have gummies, which would be a little bit easier to medicate with, a little bit more discreet if, you do have to use those outside your home. So just a couple more things that I forgot to mention. And in closing remarks, guys, use us as a resource. Please, if you're, suffering at all, this is definitely an area that you're going to want to explore, and lean on Trulieve for information, education, and don't forget about our return policy. It's honestly second to none, and the more you learn, the more you'll see that it's pretty amazing that we're willing to stand behind our products and trade anything that doesn't work for you.
I know I've used it, and I really appreciated that you had it. Let's put it that way. It's great.
Absolutely.
I know. Thank you very much.
Absolutely.
I want to thank you, Alex, and thanks Trulieve for sponsoring this webinar. I know our objective was to answer. I think we've answered all the questions. In fact, we got a couple thank yous, and so Anonymous and Chris, thank you. Your compliments get you everywhere. We really do appreciate it. But our objective is really to answer your questions. Really, if you could help you get your life back, And that's what we're really trying to do. We're trying to have just patients be able to say, gee, I've learned something. I know this is a path that can help me. And I know that there are people out there that I can rely on, consultations, people, bud tenders, not just my doctor, people that can really help me. And that's what really this is all about. And I want to thank everybody for taking the time to really research this. This is important. If pain is part of your, unfortunately, part of your party, this is something that can be addressed, and we appreciate that. As I mentioned, next week, we're going to be doing anxiety and stress. Alex, you'll be back.
Hopefully, that's a fun one for me. I actually suffer from some anxiety and stress issues myself, and it can be a little bit trickier of a hurdle for some patients. So hopefully, because I love discussing that topic.
Yeah. So anyway, so join us next week. And again, everyone will get a follow-up email. It'll have a web page that'll take you to that has a YouTube video of this presentation. It'll have the actual presentation itself in a Flipboard format. You'll have all the resources that are out there and a lot of reference material. And as always, you can always ask us questions. So again, I thank everybody, and I hope everybody has a great week. And hopefully we'll see some positives coming in 2011, 2021. Got to be better than 2020. That's for damn sure.
Exactly. Nowhere to go but up, right?
There you go.
Nowhere to go but up. Well, thanks for having me, Mark. Really appreciate it. Always a pleasure.
Thank you. We appreciate it. And everybody, thank you very much. Without you, we wouldn't be here. So thank you very much. We appreciate it.